California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Welcome to California Pediatrics, where we bring guests on to talk about how to keep kids healthy and thriving.
And we also learn a little bit about how they got to where they are today in their careers.
And today on our podcast, we are so lucky to have the medical director of one of the largest school districts in our country, LAUSD. We're going to have Dr. Smita Malhotra.
Thank you for having me.
Thanks for being here. We're so excited to have this conversation. So, we've heard a little bit about, your nonlinear path to this position, which is, again, for one of the largest school districts in the country. How did you get here?
That's a great question. Never in my wildest dreams would I have imagined that I would be doing something like this. I really got here, I would say, through one thing, following my curiosity. I think that is something that has guided me throughout my life. I'm a first-generation immigrant. Came to this country at the age of 11 with my parents, South Asian parents, which meant that I had only 3 acceptable career choices: doctor, lawyer, or engineer. They gave up everything to bring me here. They wanted me to have a safe, stable, secure life. And being a doctor meant that I could have that. I did become a doctor because, I really did love science and being there for people. But I always had this desire to be a part of, photography, writing, film. Like this is things that I've always imagined for myself. And so when I graduated residency, I was happy, but I was never completely fulfilled. Right. And I was always searching for something else. And so I started getting into photography, started getting into the photography community, second shooting with other photographers. And I started developing a following of people that then, wanted me to start photographing weddings. And so I left medicine to do wedding photography full time. And so I built this thriving business photographing weddings all over the world. And then I wanted to have children. And that was a very, very long journey for me. I could not sustain that kind of, I was always out every weekend, always traveling. Yeah. I could not live that lifestyle while I was going through such a difficult pregnancy. So I then came back to medicine. I started a private practice building meditation and mindfulness into medical visits, which is something also that I was interested in. And I built that practice. I started working with brands, and a publishing company published my first book for newborns, caring for newborns. And it just dawned on me, because every time I made these changes, I was like, am I ruining my career? What am I doing? Well, can I come back? And I realized it doesn't matter. Everyone still welcomes you back as long as you're passionate about what you're doing. Right. During the pandemic, we switched to remote learning, and I saw this job opening for the school district. LAUSD wanted a medical director to help lead the reopening of schools. And I was like, hey, every step in my life has prepared me for this. I can do this. And they wanted someone to bring wellness programs for employees and staff. And so I applied, I got the job. And it has become much bigger than I have ever imagined. The COVID-19 pandemic, I did not realize that I would be leading the largest school-based testing program in the world. Right. of COVID tests, 13 million tests done through LAUSD. I was thrust into the media spotlight, all things I've never done. But I had been comfortable with sitting in unknown and uncertainty. Sure. So that helped me. And then the school district realized that we need medical direction on our cabinet. And so they created the chief medical director position. Mm-hmm. So I'm the first for this school district. But what really bothers me is that there's only 3 of us in the entire nation for school districts.
Right.
And every school district needs to have medical leadership on
Yes.
their cabinet. And so now I lead all the medical services of the district, nursing, student medical services, employee health, mental health. And it has really been one of the most fulfilling jobs I've ever had in my life thus far. so
That's really
so that's
great.
where I am.
Yeah, that is amazing.
I know as an LA Unified parent, I'm also a pediatrician, but as an LA Unified parent, I know I really appreciated having a pediatrician leading the district's return to school effort during the pandemic, which sort of makes me think about, why is it so important to have a medical director in a school district, and what kind of health systems does the LA Unified District have?
So yeah, why it's really important to have medical direction on the cabinet is school systems and healthcare are two entities that have not really talked before. And you need a liaison to help these two entities to collaborate and communicate, because children who are not healthy are children who will not learn. And so that has been my biggest charge, getting our healthcare systems really involved with our school district. And I would say, LAUSD is so unique. I call ourselves our own healthcare system because we have the most school-based health centers of any school district in the nation. And this is literally because 40 years ago, our district invested into building school-based health centers throughout our district. And I think in 2017, the National School-Based Health Alliance stated that there are 2,500 school-based health centers in the nation. 199 of them are in California. So we realize the importance of school-based healthcare. So what we have are, school-based health centers. There's about 17 of them throughout our district, run by our own district staff. We have 19 wellness centers, which are run by our FQHC partners, federally qualified health center partners. And they are on our school campuses, but they also not only serve our students, but the community around as well. And then we also have 27 well-being centers in partnership with the LA County Department of Public Health, where they offer reproductive health education and mental health services for our students. So we do have so many school-based health services. However, our need is still great. Why? Because 80% of our students come from families living in poverty. That comes with a lack of access to healthcare. Our students' parents or caregivers are working 2 to 3 jobs. And, I have a student advisory committee, the chief medical director student advisory committee. And, I asked them, like, what is the thing you want most in terms of health and wellness? What do you want us to provide for you in the district? And unanimously, they were like, we want to learn about nutrition and cooking. We want to learn how to cook healthy meals. And, I was like, are you cooking at this age? Like, are you making meals? And what they told me was it just tugged on my heart, because they said, no, our parents are working when we come back after school. So we are in charge of cooking for our siblings.
Oh, wow.
And our families. And so they have become the caregivers.
Yeah,
and what they
absolutely.
want is how to make healthy meals to take care of their siblings. And that really, it still gives me goosebumps to this day, because then you realize what, they can't just, a lot of our students, they may have a sprained ankle, but they're not going, they can't just go to a doctor and get that service. So what we want to do in our division is bring healthcare services to where students spend 95% of their days for 13 years of their lives, which is at school.
Yeah, absolutely.
And to do so, we've contracted with a lot of mobile health providers.
Yeah.
So bringing dental services to our school. If you have never seen dental care being delivered on a school campus, you need to contact me. I'll show you, because our providers literally bring all their stuff. They come to the school auditorium or a classroom, and here they are doing cleanings, filling cavities, like while in a school building. And some of them will bring vans, which then open up into these state-of-the-art dental care facilities. And it's truly incredible. We have vision providers that do screenings, and provide eyeglasses on site
that's
to our
awesome.
students. And so we've done many vision fairs through our district. This is a big priority for our board because, as you know, a child that cannot see is a child that cannot learn.
Right.
And I'm sure many people like myself found out that they needed glasses at school. You know, a visiting optometrist actually told me I needed glasses, and that's why I was struggling academically. So that's the case for many of our students.
Absolutely.
And then we've also launched telehealth services throughout our district where you know, students may come to their nurse's office with like a headache, stomach ache, and all they need is a simple Tylenol or Motrin. Watch them for 30 minutes and they can go back to class. So instead of having to send them home, the nurse can call our telehealth provider and the child gets services and goes back to class. Or on the other hand, you know, if they need eye drops for conjunctivitis or something, that will get called in, you know, to their pharmacy. So they don't have to not be in school extra days while getting to the doctor's office.
Yeah.
So that has been really incredible, as well as mental health services, which is now our parents can request mental health for their students through their parent portal, and it can be provided either at home or at school. Like this kind of access is unprecedented.
Yeah, absolutely.
I don't even think you or I would have this kind of access to mental health that we are providing for our students.
Absolutely. I've had the privilege of actually working in one of the wellness centers that within LAUSD, and I just remember being able to, you know, essentially get a kid to be able to start school that day, right? They came in, they needed their vaccines, we got them their vaccines, and they were in class an hour later, right? And I think that being able to get kids in school and keep kids in school is so vital to community building and strengthening children. Absolutely.
Sure.
I know that you have a background in kind of like resilience work and kind of, you know, helping kids be healthy through trauma. Could you speak a little bit about how that can inform the work around, you know, essentially a tumultuous January that has started with fires, with really distinct policy changes in our country? How can we, you know, how is that informing the work we're doing in LAUSD?
So that's a great question. I think, you know, one of the, you both know, research has shown that the greatest protective factor in a child's life is a consistent, reliable, nurturing relationship with an adult. For many of our children, that adult is not always at home. That adult is in the school. It's a teacher, it's a staff member. And so keeping that consistency is so key. You know, even through the COVID-19 pandemic, our goal was to reopen schools because why? Children need that support system. Children need to be in the schools with those adults that they rely on. And so even with the fires, you know, LAUSD tragically lost 2 schools in the fires. And as we were looking on how to find new schools for these students, what we did purposely is to move entire communities together. So the entire school community moved together to a new school, and then one school community moved to another school. And the reason for that is you want to keep that consistent, reliable, nurturing, supportive adults in those children's lives. We also have 800 psychiatric social workers that work throughout our district, and they have been so vital in the kind of services they provide, and some of them are on specific regional crisis teams. So those 2 communities that we moved, we have specific regional crisis teams that work with those communities specifically. And so we use our resources in a very, very directed manner for that reason. And but we do have this wealth of staff and personnel that really care about our students and really know how to provide the right services. So that's, I hope that answers your question just a little bit.
No, it's really, you know, a relief to hear how thoughtful you and the district have been about helping kids experience some normalcy during a very abnormal and traumatic time. And also, I think pediatricians are being asked by parents and families about you know, environmental safety for their kids going back to school, specifically with there having been a lot of, you know, smoke in the air, a lot of ash. I was just wondering if you could talk a little bit about what LA Unified has done to make sure that the return to school is safe for the kids.
So yeah, LA Unified has really gone above and beyond in ensuring safety for the kids. We've consulted with several experts, the California Department of Public Health, the LA County Department of Public Health. We've actually brought in environmental experts to come and look and test the environment in our schools. We have an entire division called the Office of Environmental Health and Safety that do this work day in, day out. We have our own air monitoring systems called Know Your Air Network, where we have specific monitors throughout our district that are very sensitive, that we've been doing this before this even happened. Right. So that have been monitoring air quality throughout our district. And then we provide guidance to our school principals on if the air quality is bad, keep kids indoors. This has been happening consistently before this event happened. So, you know, I would tell parents that, you know, our district is taking all the measures that you would want a district to take to keep children safe, and we're following guidance from our public health departments. So I think the most important thing during this time, especially, is that children need to be in school. They need to be with their trusted adults and their communities, and that through the COVID-19 pandemic, LAUSD installed MERV 13 filters in all of our classrooms, and we have air purifiers for those areas that are hardest hit. So so you can rest assured that, you know, we've taken all the measures to keep our children safe.
Yeah, absolutely. I mean, I think, yeah, that kind of the end message, I think, to parents is, you know, children are safe in the LAUSD system. And I think, you know, kids are safe at school. And that's what every parent wants to hear. I think as pediatricians, we also know children need kind of that stability and routine, and that's crucial to help them thrive. So thank you so much for telling us this whole, I mean, your path has been amazing. And yeah, we really appreciate your time today.
Thank you so much for having me.
Thanks for joining us. That was a really great conversation, Melissa. I really appreciated hearing about the extensive health system that they have at LA Unified, a lot of which I wasn't even aware of.
Yeah, absolutely. As someone who's actually, you know, again, had the privilege of working in one of those wellness centers, I had no idea really the breadth of what services are provided at LAUSD. It's really incredible. I think that call to have medical directors at every school district is just so important. And I would echo that in my own school district. But yeah, absolutely. It was a really great conversation.
No, I hope that if there are some future pediatricians listening or viewing this show, that they may be thinking about a possible future where they could be the medical director of their school districts.
Yeah, absolutely. Well, thank you so much for joining us to California Pediatrics. We hope you join us again.
Thanks.